The South African Health Products Regulatory Authority, that's SAHPRA, has given the go-ahead for COVID-19 rapid testing kits to be manufactured locally. For more on this development, we can speak to Dr. Mjwara. He's the Director General at the Department of Science and Innovation. Doctor, afternoon, grateful for your time. Welcome to Newsfeed PM. Let's begin with the sort of testing that these kits would have gone to before being approved.
Well, we started to fund the Cape Bio last year, so that was around about March, April last year. We issued reports around the Innovation Agency, and they started to develop the test kits together with the Council for Scientific and Industrial Research. So the tests ongoing have taken approximately, let's say 7 months plus minus, where they've been doing in collaboration with the CSIR these tests until, of course, SAHPRA approval that was granted after they applied to SAHPRA.
Our line to you, Doctor, is slightly unstable, but please just stay with us and let's persevere as much as we can. So I was looking at some of the articles, the reporting on this. I understand Cape Bio aims to produce, 5,000 kits a day, and each kit would provide 1,000 tests. Are we heading in the direction where South Africa would be solely reliant on this production line for the rapid testing?
Well, they've started to manufacture at the factory that they have at Centurion. So as you say, they will be able to produce 5,000, and they will be contributing to about 1,000 kits. That's not the total number of tests that South Africa needs to do, but this is a small contribution that a company that is funded by an agency of government has already started to produce kits which will be used in South Africa but also export. And as you know, even though we are vaccinating, the issue of tests even within South Africa and the rest of the continent are still required, and therefore we are very, very happy with the contribution that they would make. One anticipates that as the orders increase, they would start to produce more than the number that they are able to do of 5,000.
You touched on this slightly, the issue of where the kits will go. Will they go primarily to public health facilities?
Yes, the idea is to work with the National Institute for Communicable Diseases to be able to do these tests, but also because, as you know, Cape Bio is a private company, we expect them to be able to export and to also assist sports facilities that would need these rapid tests, as well as any other a customer that has an interest in buying the kits.
And let's talk, because Minister Blade-Nzimande has spoken about this as well, about how this possibly could be a game changer in COVID-19, especially in detection.
Yes, it is. As you know, one of the things that has been happening in South Africa at the moment is that the bulk of the test kits that we have are imported. And there's nothing wrong with imports in South Africa, but we need to also start thinking about how do we make sure that we build our own companies and that we support the rest of the continent, and then we start to export. I was reading on a paper today that shows that our exports in South Africa are going to increase by about 5% in the next year or so. And this is coming mainly from the work that the department and government has been supporting in particular. And this test kits is one of those areas. As you know, there was an announcement that was made recently between BioVac, our local company in Cape Town that is producing vaccines, together with Pfizer and BioNTech, also on the future of starting to produce local vaccines in South Africa, or at least the mRNA vaccine in South Africa.
So you've got BioVac helping, especially in the early stages of the fill and finish for the COVID-19 vaccines. That was announced, I think, about a month or two ago now. You've got Cape Bio that's now going to help produce rapid test kits. It's going to produce them wholly. What is the next milestone for you, especially as far as innovation related to COVID-19?
Well, in the vaccine work, this mRNA is one of the platforms that we think in South Africa are important. And as we have said, they will continue to produce biotech initially fill and finish, you're correct. But the idea is to go the entire value chain, where you start by finding the active ingredients, and then you put all the necessary stabilizers and be able to make sure that you don't just receive the ingredient and you fill and finish at biotech, but you also start to move up the value chain, as we call it. So this is one chain that we have focused attention on, the mRNA, but we think that South Africa needs to also use this opportunity and use this challenge of COVID-19 to build other platforms, because as you know, not only are we producing under license, of course, at BioVac COVID-19 vaccine, we are producing other vaccines, flu vaccines and others, and therefore the idea is to be fully integrated in some of those vaccines. So we've identified 2 other platforms in government where we think we need to invest in the science community that has been doing the work, but also to start setting up a private-public partnership with some industries that we have identified to look at the platforms that would be suitable for the next pathogens and the next pandemic. So that's what we're working on at this point in time, but hopefully in another 6 to 9 months, we'll be able to make a good announcement on the progress that we are making in those 2 other platforms outside the mRNA platform.
Dr. Phil Mjwara, Director General at the Department of Science and Innovation. Good to speak to you, sir. Enjoy the rest of your day.
Thank you. Thanks for inviting us.